So guided imagery is this idea that we can imagine a calmer place than where we're at now, or a state of the body that's maybe different than what it is in now. And so if somebody's experiencing a lot of discomfort, there have been studies done that have shown that they can actually think about their body healing itself, and there's been some progress shown around that being beneficial. Of course, it's not to the point where it takes away MS or anything like that, but to offer people a little bit of relief, absolutely. Basically, the idea is that people will imagine. I'll give you an example. So it's been used for patients who are doing the injectable medications. So around, finding a calm place to be before they're injecting the medication in their body, imagining that the medication is going to be helpful to them and that it's something that is very healing. So those kinds of thoughts help to, benefit the exercise for the patient. From the studies I looked at, guided imagery is really more beneficial for anxiety-based issues and some internal healing in the body. And then progressive muscle relaxation is really more for fatigue and sleep and depression, things like that. Guided imagery is actually not recommended for people with more significant depression because people who are very depressed have difficulty imagining positive, relaxing places, and so it could become a detriment if they're imagining places that aren't so positive. I think of it as a supplement. I think if somebody's dealing with anxiety and depression that is significant or that is disruptive in their lives, really talking with a professional is going to be the best route as far as treatments go. But these are things that professionals can teach patients in therapy sessions, for example, that can help them cope with these things. So it's not in any way a supplement for therapy sessions or for medication treatment if there's a need for that. But yeah, it can offer a comfort to patients, and it can give them a sense that they have some control, like there's something that they can do every day or every other day or when things feel bad that can be beneficial to them. I would imagine that it's probably used more with therapists, so clinical social workers like myself, clinical psychologists who are in private practice, anybody who's doing therapy with clients, perhaps psychiatrists maybe, and I'm not sure. Some of the studies I was looking at on progressive muscle relaxation, it had been used in some of the clinics, medical clinics, so I can't remember exactly who was leading it. But yeah, I think anybody can do it. It's pretty easy to learn how. You kind of just need a soft patient voice is really all it takes to lead somebody through an exercise.